Hi, very good afternoon, audience. My name is Pallavi and I'm a counseling psychologist. Our topic for today is PCOS and mental health. It's very interesting to see how body and mind is connected and how we can deal with certain challenges our body throws, especially when we are dealing with conditions like PCOS. So, what's PCOS basically? It's polycystic ovary syndrome, and mostly seen in just in women right from puberty to middle adulthood stage, where women go through challenges with their not just body reproductive system but also with their mental health. Now, when we have to talk about PCOS or issues related to mental health in PCOS, I have to tell something. Most of the time, we wouldn't be even aware that this could be because of a problem with my body, a condition like PCOS, because many people think that issues related to mental health are mostly due to circumstances, challenges regarding stress or relationships or things like how I think, my thinking patterns and all this stuff. And we end up even giving the chance for us to understand what is our body telling us, what is happening to our mind in dealing with challenges thrown by our body. So, at this point, and today especially, we would like to understand what is this condition PCOS that has an impact on our mental health and how to deal with certain challenges that are posed by PCOS and women who suffer through this condition called PCOS. Now, when we have to understand PCOS and mental health, we need to look into a gamut of things. It not only has an impact on your body, your looks, the way you think, your mood, your relationships, and especially it basically has overall control of how you exist if you're dealing with a challenge. One thing that we need to understand very, very importantly is whenever a body and mind are very well connected, and when we are presented with a challenge that a body is dealing with, our mind definitely has certain effect on it. So when you are having issues with your mental health, especially your emotional health, your body is also suffering. We see that most of the time, right? When I'm tensed, when I'm stressed, when I'm anxious, I have issues related with my gut, I have difficulty in digestion, I have difficulty in sleeping. So vice versa, when I'm experiencing challenges with my body, it definitely has manifestation that affects my mental health. So, to understand what PCOS does, what is this link between the PCOS and mental health, we need to understand certain important aspects. Now, when anybody is diagnosed with PCOS, or even if not, when you are seeing that these conditions are surfaced, it's important to throw a light, seek professional guidance, because when you see symptoms like difficulty or in your having a stable mood, resistance to insulin, and stress, going through extreme stress, it's important that we take attention and see what is happening. So in my practice, most of the time, whether it is teenagers or young ladies or women post their marriage also, when they come, there are different reasons why they seek support, and especially they are related to emotions and feelings they are carrying, whether it is to do with their body image or how they are feeling in terms of their mood or their fears or their worries. When we actually narrow down, most of the cases derive that they are having challenges with a condition called as PCOS, probably not diagnosed. So either it is the symptoms that your mind is giving, where you would take a cue from there and go reach out and seek your gynecologist help to get the correct diagnosis done. Or sometimes it so happens that the gynecologist has already diagnosed that this person is suffering from this condition, but it is not only just affecting the body, but it is now started affecting the emotional well-being of the person, and then they recommend that why don't you seek some talk therapy, why don't you go to a counselor, why don't you get some medication if the severity is high in terms of their mood disturbances. In such case, we need to understand how we can stabilize both our mental health and physical health so that we can live a balanced life and also enjoy the life that we yearn for. Now, the major conditions or symptoms that we get to see is one is um, risk for diabetes, which increases fear, which increases worry in people. Sometimes it's very mild that people think, oh fine, it's there, if it's going to come, it's going to come. But many times people get worried because the worry of not dealing with diabetes, but the fear of going to get diabetes because of this condition is going to worsen it for many. That would lead them into a condition called anxieties, constant worry about it. Also heart disease, the reason people really get scared with PCOS is the potential risk of increased heart diseases in people who are diagnosed. So until and unless it is not taken care well, it's going to affect. So that increases the fear, anxiety, and sometimes when people become hopeless and helpless because of this, it can also lead to depression. Now, other things that we observe with people who have a PCOS is the body image issues, because there is a constant weight gain, which makes everybody think that they don't take enough care for themselves. Probably they lack self control. So, reasons for being judged or perceived lack of control is very, very high, in people who experience PCOS condition. Similarly, developing hair over the body, that is a very big challenge, because especially for teens, when they are seeing that their body is changing, there is so much change from a developmental standpoint happening, but also it is presenting you these challenges of body hair and weight gain, where looks become very important. Body shaming, all of this can bring down their self-worth and also self-esteem. It can lead to a lot of bullying among students and teens especially, and if that is not taken care, it can create a lot of strain in the parent and child attachment as well. Also, when we understand that especially young adults who are about to either they're open for dating or wanting to get married, body image becomes a big challenge. Also, fear of posed by the challenges of infertility becomes a major challenge to deal with. Now, these are some of the effects. So, when people come to me, either they're coming because they have issues with their self image, self esteem, self worth, body shaming, where they would have pushed themselves. If you understand, it can really become a cause of anxiety, worry, and depression also. And for many, the very thought of infertility can cause a lot of stress. So these are some of the things that we undertake and deal in our talk therapy. It's not that simple. It is a process. It's a very, very structured approach. Like I said, if you are already seeing a gynecologist, it's very important to be aware of how you are progressing in terms of your treatment, and also being aware of what is happening to your mind. How are you, what is your emotional hygiene like? You need to be very aware, observant about your mood, your energy levels, your social relationships, all this that is constantly telling you how you are experiencing life. And if you happen to observe that things are not really stable, it's important to pause there and reach out for help. Unfortunately, whenever we have any challenges with physical aspects of our health, we have no apprehensions reaching out for help. Simple cold, cough, we just there, we want to get diagnosis done, we want to clarify, we want to seek medication. But whenever there are issues related with our emotions, when it's related to our mental health, One thing that we need to understand, it's when we say the word mental health, it's not about something mental. Colloquially people think, having issues of mental health can be feeling low, feeling sad, wanting to isolate, lack of energy, lack of interest in doing things that you would used to do once, no excitement, no enthusiasm, disinterest in most of the things, and difficulty in connecting with people, difficulty in maintaining eye contact, and participating in conversations. All of these are issues related to mental health. So one thing that we need to destigmatize very, very importantly is to seek help when for our psychological well-being. When we have to talk about health, our health is incomplete if you're focusing just on your physical health. So if you want to, say that you're completely healthy, then it's definitely a blend of your physical health and psychological health that constitutes to your complete health. So in conditions where PCOS is diagnosed, or you are experiencing these kind of psychological symptoms of having challenges with your mood, challenges, with your levels of worry. Sometimes it's like we all go through worry, we all go through fear, we all go through a certain kind of stress. But if you see that the severity of it is getting from mild to moderate to very severe, then it's important that you seek professional guidance first to even diagnose what is this happening to you. Is it to do, is it connected with just your thoughts, your feelings, the way you are processing information, your experiences, your feelings, or is it something that is being sponsored by your body? Once you understand, then taking the right approach for your complete health becomes much more easier. We need to understand that anybody dealing with PCOS would, initially see these symptoms, and do not discount them, do not discard them, saying that this could be just because what I'm going through at work, or maybe my girl has just entered into puberty, or maybe she's feeling shy, maybe she's feeling difficulty, or this is her initial, phase of periods and stuff like that. So when we are attributing it to things that are not helpful, then your treatment and care is delayed, which would increase the severity of the condition. So, very importantly, what we recommend is be very, very aware on a daily basis on what is happening to your body, what is happening with your mind, what is happening in your social world, to understand what is that is happening and how you can cope with whatever is happening. So if we have to look at PCOS, how it affects, women of different age groups. When we look at teens, especially this is the age, most of the parents think, like I said, this is just could be because my girl just entered puberty. Or it could be like, perceived as, okay, she just started, her chums, and, maybe it is difficult for her. And that is why it is um, so painful, or maybe that is why she is now, she's her body is, developing, so that is why she has consciousness about, being her posture, or she is gaining weight and all these, or maybe she has no control over food, maybe she is unable to do it. So it's very easy to judge and say, because they don't do this is what they experience. And then you try to reverse that, thinking, oh, you have to change your food habits, you have to pick up a regime, you have to be more disciplined, you need to have self control, and these are all the advices that parents or significant others around give. But we need to understand this is a big hormonal issue. So it's not just with the mind that you can control, it needs to be worked both clinically, because it has to be corrected at a biological level. Parallelly, it needs help on how to deal with these kind of emotions, feelings, thoughts that come up. As simple as a teenager might be feeling, oh, everything is attributed to me. Maybe I'm not good enough. Maybe I'm not able to gain that self control. Maybe I should be doing things when other friends of mine are able to do it. Maybe I'm not able to do enough exercise. So the idea of inadequacy, the belief of I'm not good enough sets in at that age, and you see the consequences of this limiting negative self beliefs have a greater impact that puts children on the downward spiral in terms of their growth, in terms of their well being, especially the psychological well being. So, it's very important for the parents of teens to provide them support. Now, support begins when you are able to empathize with your children. So, engage in conversations, engage in quality conversations where you understand what your child is going through. Engage, refer, seek professional help, especially from a clinical standpoint. Reach out to a gynecologist who would understand the situation very well to see what your child is going through. Though there is no particular way of diagnosing what really causes the PCOS condition, but it's very important to understand that if a child is showing symptoms of PCOS, it has correlation with the mental health issues. So you should start observing what is affecting your child in terms of her emotional well-being. So you need to keep track of that. Develop that trust and provide the support to your child, that your child is able to outgrow her self-limiting beliefs and is able to seek support and grow as a fully functioning adult. That's very important and a primary responsibility of the parent, whether it is mother or the father, because this is the time there is so much change happening in their world. There is a lot of issues with their identity, there are a lot of challenges with body shaming, there is a lot of challenges with their effectiveness, whether it is personal effectiveness or academic effectiveness. All this are going to impact your child, all these are going to affect your child. So it's very important that the child receives a lot of empathy, love, support, acceptance, and also strategies to deal with issues related to how to cope with these challenges, whether it is body hair, whether it is body weight, or whether it is lack of self control. Eating habits are disrupted because there's a lot of craving, and all of these things can be handled provided you understand your child and provide the support. Whether it is your child or peers can also do this. When you become aware of the condition, it is much more easier to understand and provide the right support. Now, coming to young adults, or people who are aspiring to get married, it's very important. One is, of course, there is body shaming. Of course, there's body weight issues. Of course, you would get to hear many times that conceiving is very difficult. Challenges with pregnancy would be high, risk with pregnancy would be high if you have PCOS. So there is this constant, one is worry, and also shopping for losing weight. You want to exercise, you want to diet, you want to do everything, but after some time, if you are getting your periods on time, everything comes on track back. But if they don't go, then you are in that spiral again. Sometimes you might end up feeling stuck, sometimes you feel helpless, sometimes you feel hopeless, and you give up. So one thing that is very important, whether it is friends or family members or the partners, it's very important to support your people suffering with PCOS to always help them come back on track. It's not as simple as it sounds, that it's easy to put. You're not changing some device that you are changing the track and automatically the correction happens. We need to understand the fight is very hard when you have to put your thoughts on track, your feelings on track, your emotions on track, and it takes a lot of hard work to do that. So again, I say the same thing. Be empathetic to your people, understand what is happening to your body, understand that it's not easy. When it is happening to your body chemically, a lot of things can be addressed, at least supported in terms of treatment. But when it is happening at a psychological level, one needs to fight on their own So it becomes our responsibility by being their friends and family members that we provide them support. Keep encouraging them. If they are not able to be consistent with yoga, encourage them to go to gym. If they're not able to do that, pull them into some dance regime constantly, but make sure they are active. Because what happens is, when people are diagnosed with condition like PCOS, the serotonin levels are very low, which are a major cause for depression and anxiety. So your serotonin levels can be, lifted up, can be appraised by exercise, by being in the sun, being connected with the nature. So engage your people in these kind of activities, make them find more meaning in life, get them to do small techniques like writing a gratitude journal, writing a happiness journal on a daily basis, doing mindful meditation, engage in activities that they like, that they, appraise their emotional well-being. And also, very, very important, if you see yourself consumed by fear, worry, constant worry, seek professional support. It's absolutely okay. People think that seeing a psychologist once or twice, they will get dependent on it. It's nothing like that. Most of the strategies counselors provide you is to make you reliant, self reliant. So it is absolutely safe. There's no taboo, nothing to feel bad that you are seeking support. So encourage your people to seek professional support, whether it is challenges with your physical health or mental health. And coming to women who have this condition and attaining the, whether it is in middle adult hood stage, or having perimenopause, one is, of course, the mood itself is very, very disturbing at that particular juncture of your life. Then the energy is very low, disinterested takes over you, that you're not able to engage in anything that you like. You feel fatigue most of the times. You don't want to push, and that is the time where you need some peer support, not just support. And if you are slowly getting done with your responsibilities, the empty nest also takes over, which is giving you lot of voidness. So it's important that you find more meaningful engagement, more positive engagement. So make sure you surround with positive people. Make sure you find some rituals that keep you engaged positively, whether it is, going for your morning walks or evening walks, going to a place of worship, developing your faith, engaging more or engaging in social activities, doing some acts of kindness. Acts of kindness, definitely, one is they enhance your immune system. They also keep you very, very positive. So if you really want to feel happy, when you help people being happy, that takes care of your happiness. And also, make sure you don't have to find some kind of a problem in your health. It is very good practice to have your regular health checkups done, and especially with your gynec, so that you are able to prevent many conditions at the very initial stage, and you are able to take the necessary action to prevent any kind of health related challenges. So get your health checkups done regularly, stay connected with people, pursue your interest, your passion, and that is going to add a lot of positivity to your life. So if you have to happen to notice anybody who are diagnosed with this condition, PCOS, it's very, very important that you educate them, not just educate them about the physical health, but you also be aware, educate them about the challenges that it can bring in terms of mental health. So be observant, be mindful about what is happening to you, and make choices that are going to keep you more happy and healthy. So if you have any questions related to PCOS and mental health, please do write to us in the chat box given, and we would get back to you as soon as possible answering your questions. Thank you.